I'll scooch you back a little bit
Right.
to the, oh, sorry. Okay. Oh, it does seem really close. Hello, everybody. We are here to discuss Pap Smears. And the good, the bad, the ugly, the everything. So we actually have taken some time to go over some very commonly asked questions we have from patients when they come in for their annuals and their Pap smears and what they think a Pap smear entails and all the good, the bad, and the ugly. So let's start with, what is a Pap smear?
Well, Pap smear is basically a screen for cervical cancer. It's basically when we take a sample of cells on the cervix and even inside the cervix and send out to pathologists and take a look. It's not a diagnostic tool. Again, it's just a screening for cervical cancer. And if I think more people would do it, we potentially could actually wipe out cervical cancer if everyone had Pap smears on their recommended schedules.
That's awesome. So that kind of covers why do I need one, but is there any more you want to touch on, like why patients would need a Pap smear? Is there anything else that can come of getting a Pap smear other than diagnosing cervical cancer?
Well, I think it's a good step off point to talk about other things like infections like cervicitis from chlamydia, gonorrhea from sexually transmitted diseases. It's also a good point of topic to talk about periods, if your periods are too heavy or if they're too painful. Also talk about contraception. So I think it's a kind of a good central area to start from, and lots of things to talk about.
That's awesome. I love when patients get their Pap smears done. I don't particularly like getting one, but I also love when patients get them done because then we know they're being preventative. So one of the things that has come up when it comes to patients coming in for their annual exams or for an appointment was talking about a patient going to urgent care for vaginal itching, and it would, so bad that I can't take it anymore. And they did an exam and urgent care or the ER, and they're under the interpretation that that includes a Pap smear, that they've got a Pap smear done.
Yes, that question comes up a lot of times. So in general, a pelvic exam and an examination of the vagina and the cervix, we frequently kind of do the same thing, but not necessarily do we do a Pap smear every examination that a female gets. So even though you might see this, woo, 3D, doesn't mean that you necessarily get a Pap smear, because we usually use a speculum, basically just to look at the vagina and the cervix. And unless you see one of these guys or these guys, then it's more likely that you get a Pap smear. But most of the times people have the misinterpretation that because they have a speculum exam, they have a Pap smear. And the two, yes, they happen quite a bit a lot of times, but speculum doesn't always mean a Pap smear.
This does not equal this.
All the time. Yes.
What about when they see something similar to this?
Frequently we use that for a Pap smear, but sometimes we use that to, visualize the cervix. If there's some mucus in the way and we can't quite see what's going on, we can use that. Or if there's like some tissue coming out from the uterus, we can use that. But
are there things that maybe resemble this that patients may need to have done that they think they're getting?
Yeah, sometimes people can confuse that for like a swab if they're getting tested for gonorrhea or chlamydia, or also if you're getting kind of a swab to see if they have like trichomonas or if they have like a yeast infection or bacterial vaginosis.
Can be confusing.
And can be
misleading. So when we call to tell a patient that their Pap is normal, when we tell them, everything looks great, that means they don't have STDs, right? Everything is perfect, right?
Not necessarily. So again, the Pap smear, what it does is it screens for cervical cancer. But in order to test for gonorrhea and chlamydia, we have to be specific on the requisition and say that we are going to order that. So if you did want to have that done, you have to make sure that you tell your provider, like, oh, I also need a STD screening, and we'd be happy to do that. But yeah, make sure if that's what you want to have done, it's communicated correctly.
So they're two separate
Yes.
things, essentially.
Yes.
The only time you would get STD screening on a Pap smear is, like you said, if you specifically ask, I want this done too.
Right, right.
And for future reference, for folks that are seeing this, it doesn't always come on the Pap smear. Like, one, you have to ask for it, and two, it's an option. That is an option.
Correct.
Okay. Oh, this is a really good question. How often do I need a Pap smear? Well, loaded, I know. There's a couple different routes for
Yeah,
this,
a couple
but
different routes. Well, currently the recommendations are that women should start having Pap smears at age 21. Used to be age 18 or at the time of starting sexual relations. But nowadays it's age 21. And currently, if your Pap smears are negative and the age is between 21 and 29, you don't need another Pap smear for another 3 years. Although you might want to see your provider every year just to make sure that everything else is going well, because other things come up like contraception needs, talking about other period problems, making sure that you don't have any other issues going on. And for the women who are 30 and up, like myself, it's
I fall under that.
It's recommended to have Pap smears at least currently if your Pap smear, and an added bonus, the co-testing, which is looking for any of the high-risk human papillomaviruses, which are basically viruses that we get with sexual activity that can actually increase the chance of having cervical cancer. So if those two tests are both negative, the Pap smear and the screen for HPV virus, currently you don't have to have a Pap smear for every 5 years, basically. Once you're age 30 and above.
And I've always had a normal Pap smear?
Yes, and all your Pap smears are normal, or nothing else is going on. Of course, it's a little bit different if you have an autoimmune problem, say like HIV, then that sort of changes. But
okay. Is there ever, what would be the recommendation if you, somewhere between the age of 21 and 30, that you had an abnormal Pap smear? Then when I hit 30, does that change my timing of when I would need to have, rather than every 5 years?
That's one of the things when the waters become a little bit murky. It kind of depends. It depends on what kind of Pap smear you got. And it depends also on the whole clinical situation. So I hate to kind of punt, but it just depends.
Yeah. So typically 21 to 30, every 3 years, always normal every time. I get my Pap smear at maybe around age 30 or so, again normal, then I can start going every 5 years between.
If the co-testing with the high-risk HPV virus is negative.
Has been negative.
You can still do the regular thing where you do it every 3 years, but without the HPV testing. But yeah, if you add on the HPV testing, it's every 5 years.
Okay. So if you're confused, see a gynecologist and yearly, so that they can determine when you need that Pap smear. Don't try and guess. We have records, then we know when it's needed. Awesome. So this kind of echoes on that one of, if maybe I had my Pap smear last year and it was normal, so I had my normal Pap last year, and so this year I don't need an annual. I just go on about my life until I need my next Pap smear.
We usually don't recommend that because the Pap smear is only like one portion of making sure that everything is doing well. And see, like your potential cold here. So, other things happen. I mean, although the Pap smear, yes, is a screen for cervical cancer, there are other things that are going on with you. You're not just a cervix. much more. You are you are with your virus, or whatever's going on there.
I'm just choking on
No.
my own saliva.
Yeah, so we do recommend annual exams.
So that's yearly, getting one yearly, kind of like a physical.
Okay.
Good question here from Debbie Swain. How about once you have had a hysterectomy? Once you had a hysterectomy, then what is that? How does that change?
Good question, Debbie Swain.
I think she was just so excited to say hi.
Yeah, I know. So the thing with hysterectomies is it depends on what the indication for the hysterectomy was. So if you had a hysterectomy because like you had fibroids or you had bad pelvic pain or you had heavy bleeding and your pap smears were normal previous to the hysterectomy, then actually you can stop the pap smears. Woo-woo! However, if you had your hysterectomy because you had abnormal pap smears, then probably you need to continue on pap smears.
What about if they take my cervix?
You mean they just took out your cervix?
Yeah, like with my hysterectomy, what if they took my cervix too?
Oh, actually, that's a good point. Okay, so when people say hysterectomy, in like, at least the gynecological mindset, it means just to take out the entire uterus. It doesn't take out the ovaries, but just purely the uterus, which contains the cervix. So there are different types of hysterectomies, and it's really good to know what kind of hysterectomy you've got. Sometimes if you have something called a supracervical hysterectomy, where they just kind of got my props.
I like all these props.
So if your gynecologist only takes the top of your cervix, top of your uterus and leaves your cervix is down here, that's called a supracervical hysterectomy. And if your cervix is still there, then you're right. Then you still need your pap smears, depending on what age bracket you are and depending on your history. But if they take your entire uterus, all of this, including the cervix, and they did a hysterectomy for benign reasons, meaning for non-cancerous reasons, then you can go ahead and stop pap smears.
So that's,
yeah.
I mean, when you have the crummy situation of getting all of that taken away, there is a silver lining.
Yeah, there can be. Yes.
Does a pap smear tell someone if they have ovarian cancer? That question comes up very frequently.
It does. It does. So again, a pap smear is strictly looking at the cervix. It's not looking at any other parts of the uterus. It's not looking at the endometrium. So you really can't rule out endometrial cancer with a pap smear. And it doesn't look at the ovaries, which are actually inside the abdomen. So again, the pap smear is only a screen for the cervix, not for the endometrium, not for the ovaries.
So can an abnormal pap smear, let's touch on that one in a second, because there's a couple other questions in here that can kind of lead us up to that one. One patient had asked, my mom had cervical cancer, so does that mean I'm more likely to get cervical cancer?
No, because as we understand it, cervical cancer, at least the majority of cervical cancers, are caused by the human papillomavirus, and they've kind of broken them down to two subgroups: the low risk types and the high risk types. And it's the high risk types that are the causative agent towards most cervical cancers. So in that effect, if you think about it, cervical cancer is a sexually transmitted disease, so it's not a genetic thing. It's something that you get by having relations.
Can we like accentuate on that? Like, cervical cancer is a sexually transmitted disease.
Yes.
It is not
genetics. Yes.
So I think that's kind of a big thing for women to hear. It is not genetic. It doesn't skip a generation. It doesn't fall on the maternal side of things. It comes from, like you said, specific sexual relations that then cause something further. So I'm actually really glad that you said that, because that took me a long time to like ingrained in my head of it's not genetic. So, okay. Before that, I'm sorry, I got myself a little sidetracked here. Can you have an abnormal Pap smear without having HPV?
Yes.
And what are some of the things that could cause an abnormal Pap smear outside of positive HPV?
It could be a poor sampling.
So not necessarily that something's wrong.
Right. You could have an abnormal Pap smear because if you have like really bad inflammation going on, like if you had like a bad yeast infection or bad bacterial vaginosis, it could definitely maybe cause you to have an ascus, which is kind of a mild abnormal Pap smear. And yeah.
So it's possible.
Yeah, it's possible.
And what I'm understanding is like if maybe I suffer from chronic bacterial vaginosis, or I don't always know that I have. Good thing I work for a gynecologist. No, I'm just kidding.
It's difficult. Yeah.
I mean, and women do.
Yeah,
it happens, or they have cervicitis, like you said, the little infection going on. They don't know always that it's going on, and then they come in for their Pap smear for their annual, and sometimes you guys see, oh, something's not right here.
Right.
Your cervix looks a little angry.
Yes.
Or sometimes it just shows up on the Pap smear. So when somebody has that abnormal Pap smear without HPV, is there like a recommended time frame for a follow-up to see like why it was abnormal, or is it because there's no HPV we can go back to the regular guidelines? Or
well, again, I think you have to take a look at what's going on, so that's more of an individualized call. So again, you just have to talk to your provider and ask them what their recommendations are. It could be, well, let's just do another Pap smear again immediately, or perhaps we need to wait for another 6 months and redo the Pap smear. Or maybe we need to do a colposcopy, which is a more in-depth look at the cervix. It kind of just depends on what the clinical situation is and what the Pap smear is, because again, Pap smears are only a screen for cervical cancer. It's not a diagnostic tool.
I know sometimes we have patients that come in for their Pap smears, and then we give them a call and say things we didn't get enough of a specimen, or we didn't get an adequate specimen, and we need you to come back in 6 months for a re-Pap. That doesn't necessarily mean that something's wrong.
Correct.
When it says like an inadequate specimen, like that.
Right. That means that basically there was not enough specimen. It could be due to technique. It could be due to a patient being postmenopausal and just in and of itself having a more difficult time getting a sample of those cells on the cervix.
Yeah. So I do know that not frequently that happens, but frequently patients assume when we call them and say, hey, like, I need you to come back in 6 months. We didn't get enough. They immediately think that something's wrong. Right. So just kind of explaining to them that we just basically need to repeat it because we need more cells, because there's not enough there to really give us a definitive answer.
Yeah, but it's understandable,
right.
You have a reflex, so
yeah.
You get concerned.
Yeah. And my next question on here talking about, I had an abnormal Pap smear. So that means I have cancer.
No. So the current literature says that cervical cancer usually needs 10 years to develop. And in that sense, we have some leeway in most situations. But so abnormal Pap smears are basically a flag to us that we need to investigate sooner what's going on. So if any time we have a truly abnormal Pap smear, the next step for us is to go ahead and do a more diagnostic test, which is a biopsy. And that kind of tells us exactly where on the abnormal Pap smear scale we are at. So what that entails is, unfortunately, this guy again.
More of that.
Yeah, where we do a colposcopy and do a more in-depth look at the cervix with a big microscope on a stand. And frequently we get a biopsy just to kind of correlate what's going on with what the tissue actually says to what the Pap smear shows.
And we can just touch on this just because it's the topic right now. The colposcopy can then show multiple different things, just as a Pap smear would. A couple different things, and knowing that there's, you know, a couple. So like if somebody has an abnormal colposcopy and they think, oh shoot, now I need a hysterectomy to get rid of everything because something's not right. That's not always the case.
Correct. So thank goodness most of our patients, actually none of our patients have cancer, thank goodness. But just because you have an abnormal Pap smear and the colposcopy may show an abnormal tissue, doesn't mean a hysterectomy. Frequently what we like to do is kind of more of an intermediary step and do what's called either a cold knife cone or a LEAP procedure. So a cold knife cone is where we get a larger specimen on the cervix and just kind of make this cone-shaped biopsy. And that's also not only diagnostic, but it's therapeutic, so it can actually get rid of the abnormal tissue. Or we can do another procedure called LEAP, and that stands for Loop Electrosurgical Excisional Procedure.
Like a ballerina.
No, it's abbreviations. And what that is we use an electrified loop to basically remove the abnormal tissue, and frequently we do that at the office. And it's a quick procedure, not a big deal, and we can get rid of it. So,
is there ever a situation where a Pap smear is abnormal to the extent that you skip any of those steps and jump right to another step, or is that typically what you follow?
That's the typical protocol. The only aberration to that is if there's just a frank cancer on the colposcopy biopsy, and then that would mean a referral to a gynecological oncologist who is a cancer specialist in gynecology, and they're surgical specialists as well, and they would need to determine what the next step is. Depending on what kind of cervical cancer and what a clinical examination is, would determine if a patient would need to have a hysterectomy or if she needs more radiation and chemotherapy. So,
yeah.
But, you know, again, because of Pap smears and cervical cancer screening, hopefully we can avoid all that.
Yeah. So with a Pap smear, and I know it's a screening for cervical cancer, will a Pap smear with no additional testing show if a patient has cancer?
It can. It's very rare, but it can. And when I've had those situations, I've always needed to do a biopsy just to confirm that. But unfortunately, in those cases, the cancers are kind of far gone and pretty advanced. So very sad situations, but yes, it can, but very rare.
And I think about this because I often hear Morgan telling patients, you know, with screening for cervical cancer, and cervical cancer is the slowest growing cancer. Yes?
In the body, or actually it's the thyroid.
Is the slowest. So, okay, so I may be misquoting her. So cervical cancer is a very slow growing cancer.
It's 10 years.
My apologies. So I have an abnormal Pap smear, but my colposcopy was all right.
Mm-hmm.
Should I still be concerned about a potential for cervical cancer there, and how quickly could it expedite itself?
again, I hate to go in that gray zone, but again, it depends on what the biopsy showed. And there's always a potential of an abnormal Pap smear transforming into a cancer. But a lot of times, especially when we're in 20s and the Pap smear is abnormal, frequently those Pap smears actually, or the tissue resolves by itself because your immune system gets rid of the virus and we don't have to do anything. So don't lose hope. It kind of depends on what's going on, of course, but just because you have an abnormal Pap smear and a colposcopy may confirm that, doesn't necessarily mean we automatically go to a bigger biopsy or hysterectomy. Sometimes if it's like a low-grade change and everything was fine, we'll just kind of sit on it and just do more frequent Pap smears like every 6 months and kind of see how things go. But frequently those Pap smears kind of resolve on their own and we just kind of just watch them.
Yeah. Like that's that last question. Just because your Pap smear is abnormal does not mean you have cancer.
No,
Right.
no.
I mean, this is, I really like these little, bringing these. Can we do this more often?
We're going to talk about this like offline or what?
I think we should. I think we should. I could use some more information. So that was kind of in total the questions that we have as far as what we come across frequently with appointments. Is there anything else you feel we should touch on before we sign off here? Or
get your HPV vaccines. That's what I want to say. So if you can actually avoid getting these abnormal Pap smears with the HPV vaccines, that'd be awesome.
Is it ever too late to get your HPV vaccine?
Well, currently the FDA has approved HPV vaccines up to age 45. But however, I actually give the vaccine off-label, meaning I give it to people who are over that age, because I think the benefits of not getting the vaccine basically outweigh the risks of it. And as our society changes and more and more people have different partners, there's always a chance of exposure to the HPV virus, and to have immunity towards that is actually a good thing.
Can condoms protect you from HPV?
No.
Can birth control protect you from HPV?
No.
Okay. I know that's a common misconception of I'm on birth control, so I'm protected in all ways, shapes, or forms, or we use condoms, so I'll never, excuse me, I'll never get anything.
Because the transmission of the HPV virus is actually the genital skin. So although, like for instance, the condoms, they cover up the penis, but they don't cover up the other meats down there. So there is some spread. So, I'm just trying not to be offensive or anything.
I love it. Perfect. Oh my gosh, made my day. So if anybody else has any questions, do not hesitate to call, message, direct message, make an appointment. If you haven't had your annual this year, now's a good time to come in for it. You can then get them around every Christmas time. Then easy time to get your annuals done.
Yes.
Good marking point. Otherwise, we will we'll be on next Friday.
Actually, I think
we're not on next Friday. So we will not be here next Friday, but we will be here the following week, the following Friday for a Facebook Live. Stay tuned for what it will be on. And again, if anybody has any questions or anything, give us a call. Make an appointment. We're here. Have a very Merry Christmas, Happy Holidays, Happy New Year, all the things. See you later.